confirmed by us, do same for them. What they're telling us, and also confirmed by all modeling, is that the situation is very disturbing.
Around the world, countries are facing a very serious third wave of this pandemic. And right now, so is Canada. This isn't the news any of us wanted, but hospitalizations are surging. ICU beds are filling up, variants are spreading, and even people who had convinced themselves they didn't need to be concerned are getting sick. Even if the sun is shining and the weather is getting warmer, COVID-19 isn't done with us yet. And that means we all have to hold tight a little longer. Later today, I'll speak to Premier Ford about the situation in Ontario. I know we'll talk about what the spike in cases means for hospitals and the importance of vaccinating as many people as possible, as quickly as possible. We'll continue working together to keep Ontarians safe and support people and businesses through this next wave. On that note, I'll also be speaking to all premiers tomorrow about our continued and shared work to protect and support all Canadians right across the country. Tant qu'on n'aura pas vacciné le plus grand nombre de personnes possible,
as long as we've not vaccinated the most people possible, we must continue protecting one another by respecting public health guidelines. Almost everywhere, depending on the increase or decrease in case numbers, rules would be adjusted. Ontario, British Columbia, and Quebec have already made a difficult but necessary choice to take stricter measures to stop the surge of COVID cases. This is not easy, and we know that the measures may become even stricter, but that is what is necessary. We are doing this to save lives.
We need to flatten the curve to save lives. To young people, you've made tremendous sacrifices over the past year to protect your parents, grandparents, and the heroes on the front lines. Thank you. You are saving lives. We need you to keep doing this a while longer. If you can stay home, please do. And to frontline workers, I know you're tired, exhausted. I know you're really scared about what the coming weeks could bring because you're seeing the seriousness of these new variants and the spike in cases. You have done an unbelievable job over the past year. Know that we will continue to be there for you, and we will get through this together. If you need to take time off because you're sick or self-isolating, we've made sure the Canada Recovery Sickness Benefit is still there for you and any worker who needs it. In fact, we've added 2 more weeks to that benefit. Go to canada.ca to see how you can qualify because no one should be going to work sick right now. Of course, if you need PPE on the job, we're continuing to get you that. And above all, we're working around the clock to get vaccines delivered. You
probably know people who've received their first dose, or maybe you have received your first dose yourself. You therefore know that each dose counts. We've already delivered more than 10 million doses of vaccines to the provinces and territories. Not only have we achieved our target for March, we have exceeded those targets extensively, and from now, doses will continue to increase even more quickly. This month and next month, we will receive more than 1 million doses per week from Pfizer alone, in addition to the deliveries from Moderna and AstraZeneca. Later this month, Janssen will also start delivering its vaccine to Canada. And as I said last week, Pfizer has confirmed that they will send 5 million doses in June earlier. These doses were slated for the late summer, but we'll receive them now earlier. Minister Annan and her team, as well as the Public Health Agency of Canada, are working tirelessly to coordinate deliveries, and we are doing everything to make sure that vaccines are administered as quickly as possible.
Is delivering over 1 million doses a week to the provinces and territories, and we'll keep making sure these vaccines get to people as quickly as possible. As Deputy Prime Minister Freeland announced, we're providing additional support to the provinces and territories for their pressing needs on vaccine rollout. The federal government has paid for the vaccines, and we're happy to continue to help with more resources as needed. Because this is no time to go back and forth over who should pay for what. This is the time to do everything we can together to get as many people vaccinated as soon as possible. From day one, beating COVID-19 has been a Team Canada effort. Last summer, we delivered $19 billion through the Safe Restart Agreement to support the provinces and territories on what Canadians needed to get through this crisis. That money has helped with everything from additional staff at seniors' homes in Alberta, to modeling in BC to help keep communities safe, to mobile testing in Nova Scotia to reach rural areas. Today, we're delivering on the final installment for that Safe Restart Agreement. Our priority is for funding to go where it's needed most, whether it's for patients in hospitals, PPE for essential workers, or COVID-19 testing and screening for people on the front lines. Tout comme le premier versement,
just like the first investment, the $700 million investment announced today under the Safe Restart Agreement will help ensure the safety of people and help families and small businesses overcome this pandemic. The money invested in Canada to fight this pandemic, $8 of the $10 comes from the federal government. We want to help people overcome the crisis and make sure that our country is well positioned to build back better.
Before I end this morning, I want to take a moment to recognize that this will be an especially difficult day for a lot of people. It's now been 3 years since the terrible Humboldt Broncos crash. Today, we remember 16 people taken from us much too soon. And as we do, we stand with the families, friends, and teammates whose lives were changed forever. To people grieving across the country, we're thinking of you. I can only imagine how hard it is for you not to be able to gather on this day. And to everyone who continues to recover and rebuild, your strength is remarkable. Every day, all Canadians stand with you. Merci.
Thank you. I will now give the floor to Dr. Tam. Teresa.
Bonjour à toutes et à tous.
Good morning, everyone.
Over 1 million cases of COVID-19, including over 23,000 deaths, were reported since the start of the pandemic in Canada. And this is a stark reminder of how much we've been through. With more contagious variants driving epidemic growth in many areas of Canada, we know this virus is not going out with a whimper. But our vaccine response is getting stronger every day, and we will get through this pandemic together. Just yesterday, we marked the milestone of delivering 10 million COVID-19 vaccines to provinces and territories. Over the past week, on average, there have been almost 6,100 new cases and 31 deaths reported daily. With an ongoing increase in severe and critical illnesses placing a heavy strain on the health system in many places, it is clear that community-based restrictions will be needed a while longer. Last week, an average of almost 2,400 people with COVID-19 were being treated in our hospitals each day, representing a 4% increase over the previous week. This includes over 780 people in intensive care units, which is a weekly increase of 18%. With increasing rates of infection, we are seeing a greater number of younger adults with COVID-19 being treated in hospital. This is a reminder that COVID-19 can impact people of all ages, and severe illness can occur at any age. Variants of concern are contributing to the current resurgence. The B.1.1.7 variant is known to cause more severe illness and increase the risk of death. Of the over 15,000 variants of concern cases reported to date across Canada, the B.1.1.7 variant continues to account for over 90%, and has likely replaced the original virus in some locations. A significant increase in the number of cases of the P1 variant is also cause for concern. Cases due to this variant rose from about 460 cases a week ago to now 857 cases reported in Canada, with the majority of these reported by British Columbia and Ontario to date. Early evidence suggests that the P1 variant may reduce the effectiveness of vaccines, making it even more important to control its spread. With variants of concern posing new challenges in different locations across the country, now is not the time to travel across the regions for recreational reasons. Limit your travel to essential trips only to do your part to stop spread. Tomorrow marks World Health Day, bringing attention to a specific health concern common to many people around the world. This year's theme, Building a Fairer, Healthier World, serves to remind us of the inequitable impact that COVID-19 has had for many people in Canada and around the world. It also challenges us to ensure that our pandemic response prioritizes interventions that will support good health and safe recovery. Building in actions to address inequities in our response makes us stronger and more united. I know that we're all tired and looking forward for a break, but now is not the time to let down our guard or travel for recreational purposes. Please continue to follow local public health recommendations, stick to the safer habits we've learned, and get a vaccine when it's your turn. The bottom line is no one is protected until everyone is protected. Thank you.
Bonjour à toutes et à tous.
Good morning, everyone.
De la pandémie au Canada, il y a eu plus d'1 million de cas de COVID-19.
Over 1 million cases of COVID-19, including over 23,000 deaths reported since the start of the pandemic in Canada, is a stark reminder of how much we've been through. With more contagious variants driving epidemic growth in many areas of Canada, we know this virus is not going out with a whimper. But our vaccine response is getting stronger every day, and we will get through this pandemic together. Just yesterday, we marked the milestone of delivering 10 million COVID-19 vaccines to provinces and territories. Over the past week, on average, there have been almost 6,100 new cases and 31 deaths reported daily, with an ongoing increase in severe and critical illnesses, placing a heavy strain on the health system in many places. It is clear community-based restrictions will be needed a while longer. Last week, an average of almost there is an internet problem with Dr. No. Interpretation will resume when the sound resumes.
Okay, while we wait for the technical issues with Dr. New, let's open the questions for media.
Nous rappelle que la COVID-19 peut toucher des personnes de tout âge et que les
COVID-19 can
personnes de
affect
tout
people
âge
of
peuvent
all
tomber
ages,
gravement
and
malades.
people of every age
Les
can
variants
be
préoccupants
severely
y
ill.
contribuent.
Variants
Nous
of
savons que le
concern are
variant
contributing to the
B117
current
peut rendre les
resurgence.
personnes plus
The
gravement
B
malades et augmenter le risque
variant
de décès.
is known to cause
Parmi
many
plus de
severe
15 000
illness
cas
and
de
increase the
variants
risk of
préoccupants
death.
signalés à
Of
ce
the
jour
over
au Canada,
15,000
le
variants of
variant
concern cases
B117
reported to date
continue
across
de
Canada,
représenter
the
plus de
B117
90%
variant
des cas
continues to
et a
account for over
probablement remplacé le
90%
virus
and has
initial
likely
à certains
replaced the
endroits.
original
Nous
virus in
sommes
many
également
locations.
préoccupés par l'augmentation
A
importante
significant
du nombre
increase
de
in the
cas
number
du
of
variant
cases of the
P1.
P1
Le
variant
nombre de
is
cas de ce
also
variant
cause
est
for
passé de
concern.
460
Cases
il y a
due
une
to this
semaine
variant
à
rose from about
857 en ce
460
moment au
cases a
Canada,
week ago to now 857 cases reported in Canada, with the majority of these cases reported by British Columbia and Ontario to date. Early evidence suggests the P1 variant may reduce the effectiveness of vaccines, making it even more important to control its spread. With variants of concern posing new challenges in different locations across the country, now is not the time to travel across regions for recreational reasons. Limit your travel to essential trips, only to do your part to stop spread. Tomorrow marks World Health Day, bringing attention to a specific health concern common to many people around the world. This year's theme, Building a Fairer, Healthier World, serves to remind us of the inequitable impact that COVID-19 has had for many people in Canada and across the world. It also challenges us to ensure that our pandemic response prioritizes interventions that will support good health and safe recovery. Building in actions to address inequities in our response makes us stronger and more united. I know that we are all tired and looking for a break, but now is not the time to let down our guard. Please continue to follow local public health recommendations. Stick to the safer habits we've learned and get a vaccine when it is your turn. The bottom line is no one is protected until everyone is protected. Thank you.
Thank you, Dr. New. We'll now turn to questions from media. We'll start on the phone. One question, one follow-up. Operator.
Thank you. Merci. Please do not hesitate to press star 1 on your device's keypad. N'hésitez pas à faire étoile 1 sur votre appareil. Première question, Marie Vastel, Le Devoir. À vous.
Question, Marie Vastel, Le Devoir.
Marie Vastel?
Oui, bonjour, vous m'entendez?
Good morning, can you hear me?
Ben, je m'entends en écho, donc vous avez ma
I am getting an echo.
Je sais pas si ma question est pour vous, Monsieur
My
Trudeau,
question is for you, Mr. Trudeau. Maybe Minister Haidou may want to add. I would like to know what you have arrived at when it comes to the vaccine passport. In the United States, the CDC has changed its regulations recently for travel, saying that people who have not been completely vaccinated will still be at risk. There's lots of problems at the borders. We have family members who've been separated and also businesses. So do you intend to relax the rules for those who are completely vaccinated, particularly for the United States, so that maybe vaccines should proceed quickly at the border? Answer. Thank you very much for your question. Many people are thinking of what they can do this summer, thinking about trips and family visits, but we are not yet there. We are still in the middle of a very serious third wave. People must be very careful in the upcoming weeks for us to flatten the curve. That is the main priority. Of course, we all hope to be able to reopen the borders so we can start traveling in the coming months. We shall continue working with our partners in the United States and elsewhere in the world to make sure that that is done the right way. We have already seen the importance of vaccines for international travel before the pandemic. It's going to be important, but when it comes to the details of what we've done, we are still working on them. But of course, as you said, it's not right away. We are going through a third wave, and we must continue hanging in there for a few more weeks so that we can really flatten the curve and allow that the vaccines that will arrive in millions in the coming weeks have an effect. Patty.
Well, thank you very much. And the Prime Minister is absolutely right. Now is not the time for Canadians to be thinking about traveling as we work so hard to flatten the curve. And we, thank the many, many Canadians who are sacrificing in ways that we see, in ways that we don't see. I'll just say that on the topic of vaccine passports for international travel, of course, we remain committed to having those conversations with our international partners, because however that conversation evolves, we want to make sure that Canadians have the right kinds of documentation for future travel.
Ms. Marie?
Oui, merci. Je comprends que
Thank you. I understand that it's not something that will be done tomorrow, but in other countries, progress has been made with vaccines. It's not really time for Canadians to travel, but some people have received 2 doses of the vaccine elsewhere and may want to come back here for business reasons or for personal reasons. Are you making progress on that front? Are rules going to be relaxed for people who want to come here if they are completely vaccinated? What do you intend to do with people who were vaccinated with a vaccine not approved in Canada? If people receive, for example, the Chinese or Russian vaccine elsewhere, these vaccines are not recognized in Canada. Will that be accepted as proof of vaccination when they come here? Answer, that's a very good question. The reality is we will rely on evidence at every stage. We will continue looking at studies. We will continue working together with our partners like the United States, who may take some measures before us, but we will make sure that we do what is necessary to protect Canadians at every stage. We continue monitoring evidence, and we continue listening to public health experts to find out what measures are appropriate for people who are vaccinated and those who may have been vaccinated by vaccines that are not approved. So we'll continue relying on them.
Next question, operator.
Thank you. Merci. Next question, Kate Bolingaro, Bloomberg. Line open.
Hi, Prime Minister. My question is for you. I am wondering, what does Janet Yellen's push for a harmonized corporate tax rate mean for Canada?
Well, I think we're all looking forward to conversations at the G7, at the G20 in the coming months with the international financial institutions about how we're going to not just get through this crisis and come back stronger everywhere, but how we can ensure that our international financial systems and institutions are the right ones for the coming decades. I think there's a lot of lessons that we've learned from this pandemic that we're going to be able to talk about all together, and we'll be open to hearing various proposals on how to make sure that growth is inclusive, that opportunities are there for everyone around the world. Canada will always look to ensure that we are competitive with other countries around the world in terms of taxes.
No follow-up, Kate?
And President Biden is urging the U.S. to open up vaccines for all citizens on April 19th. And what is your comparable date for Canadians?
As I've said, we intend to have every Canadian fully vaccinated who wants one by the end of the summer. We have passed our milestone that we'd promised for the end of March of having 6 million vaccines. As you've just heard, we're actually over 10 million vaccines delivered. So we're doing well, but there's a lot more to go. The tentative numbers we have out is we're optimistic about having more than 44 million doses of vaccines arrived in Canada by the end of June. Various provinces will do the math differently, will sequence different populations, as is right, with different postures in this disease across the country. Our job as a federal government is to work every single day to get more doses to this country as quickly as possible. This past week was a record week, but we're looking forward to getting even more in the coming weeks. That's what Minister Anand and her entire team are working on every single day. We know getting as many vaccines as possible, as quickly as possible, is the way we get through this as rapidly as we can.
Thank you. And we'll take one more question on the phone. Operator.
Thank you. Merci. Prochaine question, Philippe Vincent Foisy, Radio-Canada. À vous.
Question, Radio Canada. Good day, Mr. Trudeau. I have a question on vaccines. You're saying that all is well when it comes to vaccine deliveries, but when we look at what happened during the weekend, even your health minister said millions of doses were sent to the provinces, and they are the cause of delays. And when people ask, why have I not been vaccinated, in spite of all the millions of doses that have been delivered, and you say it's the fault of the provinces, is that really the heart of the problem? Answer, people have seen that we have delivered a significant number of vaccine doses over the past weeks, and we shall continue to do so. That is the responsibility of the federal government. Obtain doses from abroad, pay for those doses, and send them to the provinces. But of course, as you have stated, we shall be there to help the provinces to administer them as quickly as possible if they need our help. Follow-up question? Yes. What does it mean concretely? When you talk about help them administer the vaccines, what does that statement mean? People are hearing you talk of millions of doses, but they are not vaccinated. Answer, I think people recognize the fact that we must all speed up the vaccination in the coming weeks. Lots of doses will be coming on from Moderna, AstraZeneca, and very soon, Janssen will also start delivering to Canada. So we shall continue doing our job to make sure that more and more doses are delivered throughout the country. But if the provinces need additional resources, additional assistance, we shall be there with those resources to make sure that those vaccines are administered as quickly as possible.
It's Annie Bergeron-Oliver with CTV National News. It's been reported that there will soon be about 90 million doses of AstraZeneca sitting unused in the United States because the FDA has not yet approved AstraZeneca. Do you think it's right that the Americans are sitting on tens of millions of vaccines they can't use? And do you intend on asking President Biden for some of these doses to be delivered to Canada immediately?
We have continued to engage in conversations with partners around the world, including the United States, about getting more doses quickly. We recognize that the United States has actually already sent us 1.5 million doses of AstraZeneca, which arrived last week, and are looking at ensuring that their closest partners and neighbors, for economic reasons and for reasons of family and proximity, get vaccinated as quickly as possible. We continue in those conversations with them, and we're hopeful that we'll all be able to get through this quickly.
CBC, you're talking about the federal government potentially helping the provinces get more vaccines out. I'm wondering specifically, do you envision federal vaccine clinics? Like, what specifically can the government do to make sure more vaccines get out faster?
Well, for example, from the very beginning, we've been present in remote and northern Indigenous communities to help with vaccination efforts for the most vulnerable. That was part of our strategy from the very beginning, to recognize that in Arctic communities and northern and remote communities, we needed to take special measures to not go in back repeatedly for every time we drop the ages by 5 years, as the rest of the country has done, that we were just going to vaccinate over 75% of those northern and remote communities once, so that we're able to protect people. And those are the kinds of things that the federal government is doing. We have handled and been there to support the logistical rollout of vaccines and distribution across the country. And as provinces have asked for extra help, whether it's extra resources, extra medical personnel, or logistical support staff, we have been there to respond to them. The provinces in general have been very clear that they feel that the vaccination is something that they are able to handle on their own. But as always, we have a Team Canada approach. And if anyone needs extra help, the federal government will be there, as we have from the very beginning, whether it's on vaccinations, whether it's on contact tracing and rapid testing. We sent tens of millions of rapid tests to the provinces in the fall. We're continuing to work with them on getting them rolled out, whether it's on direct support for businesses, for communities, for individuals, for families, for seniors, for youth people. The federal government has stepped up with 8 out of every $10 spent on recovery and support during this pandemic coming from the federal government. We will continue to be there to make it through this final wave, hopefully, as rapidly and as effectively as possible. Depuis les tout débuts,
from the very beginning, the federal government has been there to help provinces overcome the pandemic. We still respect the jurisdictions of provinces. Some provinces said they did not need our help for vaccines to be administered to patients. But we shall, of course, be there to continue providing support where needed, just as we did in rural and northern communities. And as we will continue to do with contact tracing, rapid testing, direct support to small businesses, health systems, families, and workers. We've been there right from the very beginning to help, and we shall continue being there once the provinces so request. But our priority is to make sure that the greatest number of vaccines possible are delivered as quickly as possible. And that is exactly what we're doing. Last week, we beat all records for vaccines delivered, but we know that there's still a lot of work to do, and we shall continue delivering those vaccines.
You're going to be talking to the Ontario Premier later on today. Ontario and Ottawa have been pointing fingers at each other in terms of supply of vaccine, distribution of vaccine. I'm just wondering, not just Ontario, other provinces as well. So how do you say there's a Team Canada approach to this when there's this level of sniping between the levels of government?
Well, I think we're in a situation where everyone is exhausted, not just families, workers, small businesses, frontline workers, but also leaders. This has been a very, very long year. And as a federal government, we've not engaged in pointing fingers or laying blame or judging. We're not going to do that. We are there to help. I made a simple promise way back in the beginning of this pandemic that we would have people's backs. And that's what we've done. Have we done everything perfect? No, of course not. But are we continuing to work hard every single day to get more vaccines into the country and to support provinces and territories on delivering those vaccines, of investing in contact tracing, in rapid testing, in supports for families, in this sickness benefit, for example, that we're announcing is renewed by 2 more weeks so that people don't face impossible choices about going to work and risking infecting your neighbors or putting food on the table. We have been there every step of the way to support the Team Canada approach, and we will continue to. Depuis les tout débuts,
Answer repeated in French. From the very beginning, the federal government made a simple choice to be there for Canadians for as long as possible with all the resources that will be required. And that is exactly what we did. Be it with the delivery of vaccines from abroad, partnerships with the provinces on testing, contact tracing, investments like the Restart Fund. We shall continue being there. Understand that people are tired. People are exhausted. Be it first-line workers, families, seniors, young people, even the leaders themselves. It is not easy, this pandemic. And I understand that it can sometimes be frustrating. But as a federal government, we have been there for people, we have been there for the provinces and territories, and we shall continue being there by doing all we can to deliver the greatest number of vaccines as quickly as possible to be able to overcome together.
Beeman, Global News. Hi, Prime Minister. With more younger people getting more seriously ill, as you know, that's prompting a push, especially in Ontario, to prioritize essential workers. understanding that those vaccination decisions are up to the provinces, what do you think needs to change about the rollout? And will you be asking Premier Ford on your call today to prioritize essential workers?
I look forward to speaking with Premier Ford this afternoon and offering whatever support I can offer. We know that the situation is serious, not just in Ontario, but right across the country, and different jurisdictions are making the decisions that they feel are appropriate for them to keep people safe, to get through this as quickly as possible. And I'm going to check in with him to see what we can offer as a federal government to help get Ontarians and indeed all Canadians through this as quickly as possible.
And on essential workers, there are calls still growing louder for guaranteed sick leave. I understand that you've extended the recovery benefit, but are there talks underway at the federal level for guaranteed sick leave as separate from the benefit?
We brought in a 2-week sick benefit, recovery benefit to ensure that anyone who comes down with a sniffle or symptoms or has to self-isolate is able to stay home and not worry about being able to pay the rent or put food on the table. That was an initiative that the federal government went forward with, and given this third wave, we've extended it by another 2 weeks, so that's available for people. And if you want to find out how to apply for it, just go online to canada.ca. And you'll be able to canada.gc.ca, and you'll be able to figure out how you can apply for it, because we want people to understand that even during this third wave, the federal government will continue to be there to support them. Now, a number of provinces have moved forward as well with complementary measures, and I encourage people to look into the supports that they can get as well. We need to hold on. We need to hang in there to get through this third wave by holding tight and looking out for each other and flattening this curve. And everything we can do as a federal government, everything we can help the provinces do is going to help us get through this with one last push.
Good afternoon, Mr. Trudeau. Mana Hamidi with the Canadian Press. What's your reaction to the charges in Iran on the tragic airliner shoot-down? Do you trust the justice system in Iran to deliver justice to the families of the victims?
We are tremendously concerned about the lack of accountability that Iran continues to have on this issue. The lack of transparency, the lack of a full and total investigation means that Canada, along with our fellow countries in the International Contact Group, will continue to put pressure on Iran to deliver true accountability and justice, compensation for the families. I spoke this morning with President Zelensky about the ongoing criminal trial and got an update on that. We will continue to work with the international community, work to reform international aviation standards, and mostly work to make sure that the families that I had the opportunity to meet with and sit down with, who continue to be heartbroken and will for the rest of their lives on the losses of these loved ones, get closure, get compensation, and mostly get justice from Iran.
Thank you. That concludes the time the Prime Minister has. The doctors and ministers will still be around for questions in just a moment.
During this uncertain time, we're doing our part. Our financial centers may be closed for in-person meetings, but our dedicated financial advisors are adapting to the new reality of virtual and electronic business, focusing on what they do best, listening and providing professional advice to you, their clients. Our more than 700 financial advisors across Canada have been working tirelessly to respond to your questions and concerns. Being proactive and committed, they aim to bring a sense of confidence and security in your financial future, despite the circumstances. Our financial advisors are here for you, now more than ever. From all of us at Desjardins Financial Security Independent Network, stay safe and healthy.
Serious illness doesn't discriminate. As such, it can strike any of us at any time. The onset of a serious illness can have significant consequences on physical, psychological, and financial health. That's why Health Priorities from Desjardins Insurance is there for you. It allows you to focus on your health without the financial burden that can accompany such a diagnosis. Essentially, Health Priorities gives you peace of mind as it grants you the financial freedom of allocating those funds to wherever you need them most. And because 1 in 2 Canadians is expected to be diagnosed with this disease, Health Priorities covers all types of cancers. If you return to being in good health, you may be eligible to receive a refund of your premiums at the end of your contract. Whether you're a parent at home, a business owner, or a salaried employee, your advisor can help you set up your personalized critical illness insurance plan if ever you should have to face such a reality. By offering one of the most human and comprehensive solutions on the market, Health Priorities from Desjardins Insurance helps you through your illness so you can fully focus on what matters most: recovering.